I'm Catherin Harris, and today we're going to talk frankly, calmly, and practically about something that many men never say out loud, but think about all the time: rapid ejaculation. If this is happening to you, you're not broken, you're not alone, and you absolutely have options. What you'll hear now is not theory or magic tricks. It's a step-by-step, real-life plan you can start using today. I'll guide you through 3 techniques that consistently help men gain control: start-stop with breath pacing, the gentle squeeze reset, and pelvic floor retraining with mindful awareness. You can practice them solo, integrate them with a partner, and adapt them to your body. I'll also show you how to track progress, communicate with confidence, and build a routine that actually sticks without shame or pressure. Let's begin by removing the fear. Rapid ejaculation is a reflex that fires faster than you want. It's influenced by arousal speed, pelvic floor tension, sensitivity, stress, and habits learned over years. That reflex is not a life sentence. It's a pattern, and patterns can change. Think of control like volume on a speaker. Right now, the system jumps from quiet to maximum too quickly. Our job is to add levels in between. So instead of 0 or 100, you have 20, 40, 60, 80, and you can hover where you choose. The 3 techniques you're about to learn do exactly that. They slow the climb, give you reliable reset buttons, and retrain the muscles in the mind that drive the reflex. First, the start-stop method with breath pacing. This is the foundation because it teaches your nervous system how to stay near high arousal without tipping over the edge. If you skip this, every other trick will feel like a temporary fix. Here's how to build it the right way. Start with solo practice 2 to 3 times per week for about 15 minutes. Before any stimulation, take 2 minutes to breathe through your nose, exhaling slightly longer than you inhale. For example, inhale for 4 seconds, exhale for 6. Your shoulders stay loose, your jaw unclenched, your stomach soft. This matters. When you hold your breath or clench your jaw, you escalate adrenaline and speed up the reflex. Now choose a comfortable level of stimulation and use the traffic light scale. Green is low arousal, yellow is rising, red is the point of inevitability. Your training zone is high yellow, intense but still steerable. The moment you feel yourself moving into red, stop all stimulation and keep breathing with that longer exhale. Do not distract yourself with unrelated thoughts. Stay present and feel the peak come down. When you drop back to green or low yellow, start again. Repeat this cycle 6 to 10 times in a session. As you practice, add a metronome of breath to your rhythm. 1 inhale for stillness, 1 exhale as you reintroduce motion. This anchors your body to a slower tempo and prevents the runaway escalation that used to surprise you. If you accidentally cross into red and ejaculate during practice, no problem. Note which breath count and rhythm you were at, then next time slow it by 20%. Control is learned through dozens of small, successful laps, not through one perfect session. After 2 to 3 weeks of solo training, bring start-stop into partnered intimacy. Tell your partner you're training for control and ask to pause together when you raise your hand or say a simple word like pause. During pauses, you both switch to the longer exhale while maintaining closeness, kissing, holding, breathing, so the pause feels intimate, not like failure. This is crucial because it rewires your brain to interpret taking a pause as connection and mastery, not embarrassment. Do 2 to 4 start-stop cycles in a single encounter, then let whatever happens happen. You're building a skill, and each cycle is a repetition that counts. Second, the gentle squeeze reset. This is your quick pressure valve when you misjudge the edge. The classic squeeze method is often taught with too much force, which creates pain and more tension. We are going to do it properly and gently. When you feel the unmistakable rise into red, often noticed as a tight pull low in the pelvis, a breath hold, or a rapid jump in sensitivity, pause all movement. Place a gentle, steady pressure with your fingers on the most sensitive ring of tissue just behind the head of the penis, or apply a broad, even squeeze around the base of the head using your thumb on one side and 2 fingers on the other. Your goal is not to pinch or numb. Your goal is to send the nervous system a wait signal. Maintain that light pressure for 3 to 5 slow breaths, exhaling longer each time. Notice the urge subside from red back into yellow. When the intensity drops, release slowly, keep breathing, and reintroduce very gentle, slower stimulation, ideally with a different rhythm or less friction than before. In solo practice, combine gentle squeeze with start-stop. Twice per session, choose to approach the edge and then use the squeeze reset instead of just stopping, so your body learns both options. In partnered settings, make it feel like a playful change of pace. A simple line, "Give me a second, I want to make this last," frames the pause as care, not a mistake. Let's connect the first 2 techniques with a simple rule set you can remember under pressure. Rule 1. Breathe first, move second. If your exhale is shorter than your inhale, you are accelerating. Lengthen the exhale to downshift. Rule 2. Change one variable at a time. If you were using a fast tempo, switch to slow. If you were using high friction, switch to low. If you were tensing your abs, relax them. Rule 3. When in doubt, stop and squeeze. A 5-breath pause with gentle pressure is faster than recovering after an involuntary finish. Rule 4. After a reset, do not jump back to the exact pattern that triggered the edge. If you do, you'll hit the edge again within seconds. Choose a new pattern, slower tempo, shallower depth, more stillness between movement, and keep the longer exhale. Third, pelvic floor retraining with mindful awareness. Many men with rapid ejaculation don't just have a sensitive reflex, they also carry chronic tension in the pelvic floor, the sling of muscles that runs from the pubic bone to the tailbone. When those muscles stay braced, often from stress, breath holding, or years of trying to control by clenching, they behave like a tightly coiled spring. A tiny increase in stimulation makes the spring snap. To change that, you need 2 skills: learning how to relax the pelvic floor on command and building balanced strength that supports, not triggers, control. Start with reverse Kegels, which are the opposite of the classic squeeze. Sit or lie down, place one hand on your lower belly, and imagine gently widening at the sit bones or softly releasing the muscles you'd use to stop urine. Inhale through your nose as if the breath were moving down into the pelvis, and feel a slight expansion in the lower belly. Exhale without forcing. Do 10 slow breaths twice a day and specifically practice this before intimacy. You're teaching your body that arousal can rise while the pelvic floor stays soft. Next, add coordination. On the inhale, let the pelvic floor down and the belly expand. On the exhale, lightly recruit the lower abdomen. Think 5 out of 100, not a gym crunch, while keeping the jaw relaxed. This pattern prevents the instinct to brace hard, which accelerates the reflex. After a week, introduce short sets of gentle Kegels to build endurance, not stiffness. Lightly contract the pelvic floor as if holding back urine, hold for 2 seconds, then release completely for 4. Do 6 to 8 reps once a day. The focus is the release phase. If you cannot feel a soft, warm let go after each tiny contraction, reduce the effort. After 2 weeks, practice this in standing, so your body learns control in a more realistic position. Combine pelvic awareness with start-stop. During each pause, scan your body from jaw to pelvis. If you find your glutes clenched, your abs hard, or your breathing shallow, deliberately soften those areas before you resume. Over time, you will notice that your red signals start arriving later, and you can hover comfortably in high yellow without tipping over. Now let's talk about putting everything together, because techniques only work when they become habits. Create a simple 4-week plan. Week 1, 2 solo sessions of start-stop with breath pacing, 15 minutes each, and daily reverse Kegel practice for 10 slow breaths in the morning and at night. Keep a tiny notebook or phone note with 3 lines you fill in after each session. How many start-stop cycles? What breath rhythm worked best? And what red signs you noticed earliest? The act of noticing is training. Week 2. Add the gentle squeeze reset twice per solo session and one partnered conversation about your plan, even if you don't have intimacy that week. State your intention positively. I'm practicing ways to make our time last longer and feel better for both of us. I'll sometimes pause to breathe or squeeze for a few seconds. When I do, stay close with me. That helps. Week 3. Bring start-stop and gentle squeeze into partnered intimacy 1 to 2 times. Keep pauses affectionate. If you use protection, consider a slightly thicker condom if sensitivity is overwhelming. If you try a topical desensitizing product, apply sparingly, wait the recommended time, and use a condom to avoid transferring it to your partner. The goal is not to mass sensation forever, it's to buy you time while your skills build. Week 4, maintain 2 short solo tune-ups, continue reverse Kegels, and prioritize breath pacing as your automatic anchor. Most men who follow this plan notice a meaningful difference, longer duration, more choice, less anxiety within 4 to 6 weeks, sometimes sooner. Let's address common obstacles so you don't misread them as failures. If you feel anxious, remind yourself that anxiety is arousal wearing a different mask. Treat it with the same tools. Long exhale, slower tempo, warm pauses. If you worry about disappointing your partner, bring them into the solution. People don't need perfect performance, they need to feel considered. A short sentence like, "I'm going to take a pause so I can enjoy this with you longer," reframes everything. If you lose erection during a pause, resist the urge to chase stimulation immediately. Stay with breath and touch. Arousal will return more steadily than if you panic. If you have pain, burning, dribbling, blood in semen or urine, or you consistently ejaculate with little pleasure or without much stimulation, see a healthcare professional to rule out infections, prostate issues, medications, or endocrine problems. Techniques are powerful, but medical causes deserve medical care. Communication can be the difference between pressure and progress. Before intimacy, set a calm expectation. You don't need a speech, just a tone. You might say, "I'm practicing making this better for both of us. If I pause, breathe with me." During intimacy, use simple signals, a hand squeeze, or a word to cue a pause. Afterward, celebrate the wins. Maybe you handled 3 edges before climax, or you noticed red earlier than last time. This is training. Athletes celebrate reps, not just trophies. If you're single and practicing solo, your communication is with yourself. Replace criticism with coaching. I hit red fast on round 2, so next time I'll slow the exhale from 6 seconds to 8 and keep my abs softer. That shift in self-talk speeds learning. There are supportive tools you can consider alongside the 3 core techniques. Condoms with slightly thicker latex or specialized textures can reduce overstimulation. Lubrication can let you control friction more precisely. Mindfulness practices, 5 minutes a day of simply noticing sensations without judgment, translate directly into staying present at high arousal. Some men benefit from cognitive strategies like changing mental narratives that say it's going to be too fast into, "I set the pace, 1 breath at a time." If you suspect performance anxiety feeds the reflex, brief counseling or sex therapy can help you break the loop. In some cases, clinicians prescribe medications that delay ejaculation. That's a conversation for a medical visit. Think of medication as an optional assist, not a replacement for skill building. You are learning a body skill, and once you own it anywhere, anytime. Let me give you a clear picture of what progress looks like so you can recognize it when it happens. In week 1, you may still climax quickly during solo practice. That's okay. The win is noticing your earliest yellow signals, perhaps a sudden breath hold or a tightening at the perineum, and recovering with breath. By week 2, you'll likely complete several start-stop cycles without climax and feel genuinely calmer near the edge. By week 3, your first urge to pause with a partner will feel brave rather than embarrassing, and you'll see that after a 5-breath reset, you can continue with more choice. By week 4, You'll typically find that your arousal rises smoothly rather than spiking. Your body obeys your exhale, and you can hover in high pleasure without the reflex firing immediately. You might still have fast days. Bodies vary with sleep, stress, and timing. The difference is you now have levers to pull, not just hope. Let's also be honest about myths that keep men stuck. Myth 1: you must constantly squeeze your pelvic floor to control yourself. In reality, constant clenching speeds the reflex. Control is about coordinated relaxation and timely small contractions, not a full-time clamp. Myth 2: thinking about something unsexy is the best way to last longer. Distracting yourself disconnects you from your partner and your own signals. You lose the ability to read yellow and red accurately. Presence with breath is more effective than distraction. Myth 3: if you finish quickly, you've failed. Intimacy is a whole experience, not a stopwatch. There are many ways to give and receive pleasure beyond thrusting, and you can move in and out of different forms of touch while you practice your skills. When you see the whole landscape, the pressure on any single moment drops, and control becomes easier. I want you to have a simple checklist you can follow tonight. Before: 5 minutes of nasal breathing with longer exhales, 10 reverse Kegel breaths, a clear intention to pause when needed. During: start at a slower tempo than your habit, keep your jaw and abs relaxed, breathe with the longer exhale, and use start-stop proactively before you hit red. If red surges, stop. Apply the gentle squeeze for 3 to 5 breaths and resume with a different rhythm. After: note what worked, praise yourself for every controlled pause, and choose one tiny improvement for next time, like, I will signal the first pause earlier, or I'll keep my exhale 2 seconds longer. These micro commitments build real control. Remember that confidence grows from evidence. Every time you pause, breathe, and watch the urge recede, you're collecting proof that your body listens to you. Every time you use a gentle squeeze instead of bracing hard, you're proving that calm beats force. Every time you relax the pelvic floor on inhale and feel arousal stay steady, you're proving that softness is a form of strength. Those proofs add up. They turn into a quiet belief. I can set the pace. If you want an optional structure to keep yourself accountable, pick 2 days per week for solo practice, say Tuesday and Saturday, and 1 day for partnered focus if you're in a relationship. Maybe Friday night with a planned slow session, where pauses are expected. Use the same warm-up each time so your nervous system recognizes the routine. Keep the sessions short enough that you don't dread them. 15 minutes of focused training is better than an hour of rushing. After 30 days, look back at your notes. You'll likely see the number of controlled cycles rising, the intensity of red dropping faster during resets, and your language shifting from worry to choice. As we close, hold this truth. Rapid ejaculation is not a moral failing, not a permanent label, and not a reason to hide. It's a reflex that can be retrained with patience, breath, gentle pressure, and smarter muscles. Start-stop with breath pacing teaches you to ride the wave instead of being thrown by it. The gentle squeeze reset gives you a safety break when the wave is high. Pelvic floor retraining gives you a softer, stronger foundation so the wave doesn't spike in the first place. Put them together, practice consistently, communicate kindly, and your experience will change. I've seen it with men in their 20s and men in their 60s, with singles and couples, with people who thought they'd tried everything. What made the difference wasn't a secret technique. It was practicing the right skills in the right order with the right mindset. You can do this. I'm Catherin Harris, and I'm proud of you for taking the first step. Now take a breath, lengthen the exhale, and start.